Good day, everybody. I'm Ken Kozel, your President and CEO for Shore Regional Health. And I am so pleased to say that I think spring has officially sprung on the Eastern Shore. And when I think of spring, I think of baseball. And I had the opportunity the other day to watch the Orioles opening day. What a great game. And the Orioles won in extra innings with a walk-off home run. But more importantly for me was what happened between the innings. The commercials that were aired between each of the innings of the game. Several times we got the chance to see the University of Maryland commercial that talks about be a part of something greater. What a great commercial that highlights and showcases our system. And if you look pretty closely, you can see a couple of our team members here on the shore that are part of our family that were also in that commercial. So it was a great day for the Orioles. I think it was a great day for the University of Maryland Medical System, and certainly for Shore, who was representative of being a part of something greater. Now let's switch gears a little bit, and I wanted to just share a little bit of information with you in this video today about some of the key things that we're working on in our system. I always like to try to connect them back to the priorities of our organization so you get a sense of connecting the dots. What are we doing? What are we working on? And how does it all come together? Well, as you know, we've got a couple of key priorities. So I just wanted to highlight a couple of advances that we're making in each one of those priorities so you could get a confidence level that we're moving in the right direction as a healthcare system. Let's talk first about our patient experience. As you know, every one of our team members was required to attend our heart training. I am so pleased to say that we wrapped up those training sessions at the end of March, and we had a phenomenal response rate. Over 98% of our team members were able to attend those sessions. We've also now incorporated them into the new team member orientation program. So every new team member coming into our system will have the heart experience and be able to take that experience and incorporate it into their daily activities. That is such an important part of the patient experience, and I'm so glad that we've launched that and that we're really making it a part of who we are and part of how we provide care here. Also, with the patient experience, we're focusing on our quietness campaign. So I'm going to turn it down a little bit because quietness is so important to our healthcare system and to the way patients care and heal. As you can imagine, a quieter environment leads to better healing, and a quiet environment leads to better team member engagements and better team member perspectives as we're going through our daily activities. So it's so important that we focus on quietness. We've launched a new campaign that will do that throughout all three of our hospital systems with the intent of really making sure that we're improving the patient experience. Let's switch gears off of the patient experience for a second and talk about our second priority, and that's innovative and integrated care. We are doing some really neat things recently along both of those lines. First of all, let's talk about innovation. As you know, we've got telemedicine capabilities in our system today, in our ICUs at all three of our hospitals. But I've been mentioning to you that that's not where we're going to stop. And actually, we've expanded our capabilities as we speak. We now have telemedicine capabilities that connect our patients who are in our emergency departments, specifically pediatric patients, with the University of Maryland Medical System. Talk about the power of the partnership. We've got pediatricians on site 24/7, 365 at the University of Maryland EDs that we can connect with for our patients here on the Eastern Shore to make sure we're providing the right care in the right location at the right time. So critical to making our patient experiences ideal. But we're not stopping with just pediatric EDs. We're also advancing telemedicine capabilities with psychiatry, and very, very soon we're going to implement palliative care telemedicine capabilities. Now these systems will start off small, but eventually within the next few months we'll have capabilities in all of our emergency departments and in all of our inpatient facilities. So that's innovative, and that's integrating our care not only throughout the Eastern Shore, but also with the University of Maryland Medical Center in Baltimore. Huge advantages along those lines. Let's talk about now access to care. That's another priority of our organization. How are patients accessing our care? I am so pleased to share with you that very recently we had our first PCI procedure done here at Easton. I had the opportunity to sit in and watch the procedure, and I was never so proud of our organization as I was that day. We had a patient who needed our care, who lived on the shore, actually came from Chestertown, and needed to have this procedure done. Through Dr. Jeff Etherton and the entire interventional team pulled together, had a fantastic procedure done, and the patient is doing well from what I understand. That is integrating care, that's access to care on our region. So that is such a phenomenal service line for us, and that makes us a very strong community healthcare system. Let's switch gears to the fourth priority, team member engagement. I first want to thank all of our team members who had the opportunity to come to one of my forums recently. At the forums, we had Bev Valtos talk about our engagement survey results. Bev did a fantastic job of talking about the differences between satisfied employees and engaged employees. And we're really striving for engaged employees here at Shore Regional Health. Because if you're engaged, you're passionate. You go the extra mile. You want to do whatever it takes to be part of the team and provide the best patient care possible. So thanks to Bev for attending all of those sessions and sharing that perspective with us, but also sharing the results. Because what's happening now behind the scenes is that information at the department level is going to your managers, and the managers are putting together action plans that are going to help us focus on improving our engagement with you, our team members. But let's also talk about something else that's going on in our system that really exemplifies engagement to me. And that is Dr. Khalid Khattam and his neurosurgical team, who is now getting ready to embark on a trip to Amman, Jordan, to care for patients there under a medical mission. You talk about engagement. You've got team members in our organization who have banded together, who are taking time from their lives and their families to go abroad and care for patients that they've never met before, that they don't know, that aren't part of our community. But that's an engagement exercise as far as I'm concerned, because that brings the heart of what they do every single day here to others around the world. I know that's a lot today, but I hope I connected some of the dots with you that for things that are going on in our organization currently and what we see in the foreseeable future. I also want to take time to thank you for listening to this video and for your engagement in what we're trying to do. And until next time, take good care.